So when it comes to selective abortion based on sex, I wonder how many American parents would actually opt for boys. I've watched anxious, newly pregnant lesbians working through the news that they're carrying boys, only to let all the apprehension go when the little fella bursts onto the scene. Women have circulated information about centrifuging sperm for the purposes of sex selection, drawing girl sperm off the top of the specimen, or I don't remember actually if that's right, maybe it's vice versa. In any case, in fact, I remember early gender predicting tests that there was one called the Drano test where you pee in a cup and you put, do you know this? Have you heard this? You're laughing.
Yeah.
I'm the only one who knows about it. You put two tablespoons of Drano in a glass and it foams up, and if it leaves a brown ring, it's a boy, and a blue-green ring, it's a girl, and it was developed by some Minneapolis OBGYN, and it was supposedly 88% effective. And it actually, that's what my friends were doing it. It was working all the time. So, at any rate, sexing fetuses goes way back. And equally interesting, there was no critique around these practices in our community. They evolved out of early feminist thinking that could get a little reductive, and let's admit it. Girls were good, boys were bad, girls were people we liked, boys were people we didn't, girls were what we were, and boys were what we weren't, girls we understood, boys we didn't understand. So I'm happy to report, particularly as the mother of a son, that we've relaxed and evolved a little over the years. Another issue I see is aesthetics. As a heavy, older single woman, I understand on a very visceral level the pain that attends selection based on appearance. But let's admit it, genetic engineering in this way happens all the time. As fertile men and women are attracted to one another based in large part on how they look, on how smart they are, on their educations, incomes, family backgrounds, and assets. When queers make deliberate choices to make a baby, they most often select genetic material that matches their partners or themselves. And yes, they seek healthy, somewhat attractive candidates. I picked a tall, really skinny guy with 20/20 vision with my blood type. When we were down to 2 candidates, my partner opted for the chemist over the sociology student, figuring that a chemist would be smarter. Since pictures of donors weren't available back then, I spent my entire pregnancy terrified the guy looked like Lurch on the Addams Family. Having a baby is terrifying. Wanting to have some control over the process to create a margin of safety and predictability that is, by definition, in a process that is a complete capitulation to the higher power or fate or destiny or luck or whatever, is very understandable. Abortion. As my lover and I sat down to a celebratory dinner the day I found out I was pregnant, she began by saying, you know, if there's anything wrong with this baby, you're going to have an abortion. Turns out we felt somewhat differently about this issue. And LGBT people hell-bent on achieving pregnancy often neglect to talk about this in advance of that pregnancy, and we need to do that. My partner had no more right to tell me I'd have an abortion than a male partner would. But in an era of increasingly routine prenatal testing and more information now accessible through those tests, it's critically important that parenting partners have those deeply difficult conversations pre-pregnancy, particularly since we are more likely to pursue parenthood later in life when genetic complications are more likely to arise. Generally speaking, I see LGBT people struggling mightily with the playing God aspects of creating a family, since it so often is a very deliberate process for us. They make semi-apologetic choices of intellectually gifted donors, blue-eyed blonde donors, tall, buff, musical, athletic, artistic donors. I never hear anyone say, I don't care, just give me whatever you've got. Is anything on sale? Nobody chooses through the eeny, meeny, miny, mo method. Why people choose who they choose is an acutely personal process, and one I couldn't begin to break down for any individual couple. Some of you may have seen that Rosie O'Donnell Cruz documentary on HBO. It's called All Aboard. And there were a bunch of families profiled, but there was one with these sort of 2 very Nordic, Midwestern women, blonde, blue-eyed women, who had 2 little children. Each of them had delivered a baby biologically with a Japanese donor. And I don't know what the backstory is on that. Nobody asked any questions about it. But I think I can't begin to guess what factors went into that decision for them. Sometimes there are old stories, sometimes there's family history, sometimes there's dear friends that direct those decisions. And sometimes it's racism, and sometimes it's some kind of random process. But I've learned to be really careful about judging it. Another issue that comes up is class. I'm a founding member of an organization called Queers for Economic Justice, and I've written and published on the issue of class and queer family formation since the late 90s. it's a problem. And I remember many years ago suggesting to my partner that Center Kids, my program, should start a scholarship fund to assist queers without much money in accessing assisted reproductive technologies. And her response was, and she was a really nice person, you wouldn't know it from this, but she said, it's not our responsibility to create a lesbian underclass. So that was a long night for us. But the problem of serious inequities in the accessibility of safe, competent reproductive health services for queers, including pre-transition reproductive counseling for trans people who may someday wish to parent biologically and who are given no information on how to provide for that possibility, continues to dog us as a community. Poor women take serious risks with their health in order to have kids, bypassing the healthcare system, having unprotected sex with men, or using fresh sperm. And then there's the issue of surrogacy, which is illegal in New York State, but it's been a pathway to parenthood for gay men nevertheless, because they just go out of state to do this. This is usually a wildly expensive procedure and therefore open to only a small segment of our population, and it's one that requires a woman to carry a pregnancy to term on behalf of the father. Until relatively recently, these women were traditional surrogates, which means the baby was the product of the woman's own egg. Now, much more commonly, women are gestational carriers who are implanted with an embryo from the in vitro fertilization of a donated egg from a different woman. This procedure, though even more expensive because both the egg donor and the gestational surrogate must be compensated, has helped minimize the emotional connection of the surrogate to the baby she's carrying. Again, I don't know how to judge this avenue. I just really feel it's important that we examine it from every angle. Critics say that surrogacy exploits women of limited means. Supporters, including many surrogates, and there's one speaking to one of our support groups tonight. She came in from Tennessee. She's carrying a baby, and she's speaking to our group of about 50 guys who are interested in surrogacy. They say it's a great way to help people. They earn extra money while they're in school or while they're needing to be home with their own small children, and they love being pregnant and so forth. It is complicated, and not unlike the arguments brewing around the issue of sex work, which has a good many very vocal, articulate, organized sex workers speaking up for their right to make choices about what they do with their bodies and resenting and resisting efforts of governments and systems to police those choices. It's the same type of situation.